Delighted to have with us Dr. Brian Rini discussing one of the highlights at ASCO 2011. He is the Associate Professor at the Cleveland Clinic Taussig Cancer Institute, specializing in renal cell carcinoma and prostate cancer. Thanks for stopping by.
Thanks for having me.
So the Phase 3 Axis-1032 trial has made some pretty significant news here at this ASCO. Can you give us an overview of it?
Sure. The Phase 3 Axis trial was a randomized comparison of Axitinib, which is a more potent and selective VEGF receptor inhibitor, compared to sorafenib, which is a first-generation similar drug in terms of mechanism, but less potent biochemically. And this looked at patients who had failed one and only one prior therapy that was largely either sunitinib or cytokines, but included all the drugs that were approved at the time of trial design.
What can you tell us about the design?
So the design was, it was a randomized Phase 3. It was not a blinded comparison. It was an open label Phase 3 where patients were randomized with equal probability to receive either Axitinib or sorafenib. Again, both oral drugs, sorafenib being standard, Axitinib being investigational.
What were your findings?
So the primary endpoint was progression-free survival as assessed by an independent review committee. And the median PFS for patients receiving Axitinib in the second-line setting was 6.7 months compared to 4.7 months with sorafenib. Hazard ratio of approximately 0.6 with a significant p-value.
Can you discuss the side effect profile?
So the side effect profile generally fell into one of three categories. So there were some side effects that were more common with Axitinib, and those would be what we call on-target side effects, such as hypertension. There were many that were very similar between the arms, fatigue and GI-related side effects. And then there was a group of side effects that was more common with sorafenib, namely rash and alopecia. So in general, both arms were well tolerated. Probably maybe the most telling number is that for Axitinib, about 3.9% of patients had to stop because of toxicity, and that number was about 8.2% for sorafenib.
What stands out most to you in the data you've presented?
I think it's another notch forward in kidney cancer. We have many of these drugs, and because there are so many, no one trial can ask and answer every question, but clearly Axitinib is an active drug. This is the first trial to compare active targeted therapies. Up till now, the comparison arm was placebo or interferon. So we're taking another step in actually comparing drugs that work in patients, trying to find the right sequence and find the right patients to give drugs. And hopefully this drug can now be expanded into other settings.
What will you do next in this research?
There is a frontline trial of very similar design compared to sorafenib, but now in the frontline setting. The trial is a Phase 3 trial that's completed accrual. And then there's another large randomized Phase 2 in the frontline setting that's also completed accrual. Both of those studies should be available in the next year or so, which will provide us much more robust data for this drug in the frontline setting, where many of us believe it'll be the most active.
Dr. Rini, thanks for stopping by and sharing your information with us, and congratulations on your work.
Thank you. My pleasure to be here.
Dr. Brian Rini from the Cleveland Clinic talking about the Axis-1032 trial here at ASCO 2011.